Good afternoon, everyone, and welcome to the Systems and Sustainability Echo. My name is Julio Sotorblanco, and I will be the facilitator for today's session. This Echo is brought to you by the Center for Substance Use Training and Telementoring, also known as CSAT by Be Well, Texas, in collaboration with UT Health San Antonio Echo program. A few housekeeping items before we begin. We have live closed captioning available for today's session. If you would like to view closed captions for this session, please navigate to the bottom window of your Zoom and select the Show Captions option. If you're having trouble accessing captions, please chat Echo IT. To help with attendance, please enter your full name, affiliation, and email into the chat. To all Be Well Texas providers, please make sure that you identify yourselves during this session, or if you are joining via phone, please email your phone number and name to bewelltexas@utesca.edu. Please remember to stay muted unless you are speaking. We encourage joining by video and using the chat and/or raise your hand feature to pose a question or share perspectives throughout the session. If you're having connection issues, please privately chat UT Echo IT Riddell for assistance. As a note, these sessions are being recorded and will be shared on our website. Therefore, to ensure privacy, no personal health information is allowed at any point during the session. This includes client or patient names, addresses, birth dates, or any other identifiable information. At the end of the session, the Echo team will send out a post-session survey link. We kindly ask you to complete it as it provides feedback on how to refine these sessions to better address your priorities. Finally, Echo is an all-teach, all-learn environment, and we encourage everyone to participate in this conversation and raise questions. Let us always make every effort to avoid bias and stigmatizing terms so that we can continue having a space that is respectful and safe to learn. So with that, we'll go ahead and move on to some team introductions. First up, we have Kathy Hudgens.
Good afternoon, everyone. I'm Kathy Hudgens. I'm a consultant that focuses on integrating behavioral health and substance use disorder treatment. I've been working in integration for almost 15 years or 20. I'd have to think about that. I'm the former executive director of the Center of Excellence for Integrated Care.
Thank you. Next up, we have Matthew Russo.
Hi, everybody. I'm Matt Rosa. Backgrounds in clinical social work and agency administration, governmental planning. I work as a consultant now in the areas of quality improvement, process improvement. A lot of that work is in the using NITEX model, and also do a lot of implementation support around evidence-based practice. It's good to be with you.
Thank you, Matt. We also have with us Lesley Manson.
Good to be here. I'm Lesley Manson. I'm a licensed clinical psychologist, a clinical associate professor, and a consultant for building sustainable and effective whole person community health. My background, similar to others here, is in clinical care, healthcare management, and working within primary care, recovery-oriented services, peer services, and behavioral health. So thank you. It's great to be here.
Thank you. And Lesley is also our didactic speaker for today. Our case presenter is Jenna Stevens.
Hello, I'm Jenna Stevens, Program Administrator for Substance Use Services at LifePath. I am an LPC and an LCDC by licensure.
Thank you, Jenna. And with us, we also have our program coordinator, Andrea Hepler. Our last introduction is going to be Dr. Adrienne Lindsay.
Hello, everyone. My name is Andrea Hebler, and I am the program coordinator for the Systems and Sustainability ECHO program. Welcome, everyone.
Thank you, Andrea.
Thank you, Julio. I know a lot of you. I'm Adrienne Lindsay. I direct our Center for Substance Use Training and Telementoring here at Be Well. I wanted to jump on today as I have an important announcement. Unfortunately, due to some recent federal and state grant and contract terminations, our center has been impacted, and we're going to be consolidating some of our ECHO programs. So this ECHO program will be paused, but we will be incorporating the topics into our other programs. So this will be our last official session within this program. But again, these aren't going anywhere. We're going to give you an opportunity when we do our announcements to show everyone how you can register for some of the other programs. And I know many of you are already registered for those programs and are regulars in a number of our sessions, but these same systems related topics will come up in our various webinar series, our annual symposium, and other places, and hopefully we'll be seeing our fabulous hub and some of those other programs as well. So our apologies, it is unfortunate, but a little bit of the current climate, and so we will do our best to continue to bring these topics to you all and be available to you in other capacities. So we will also continue to be available for technical assistance. We'll drop that link as well during the announcements. But if you're not already aware, anytime you can go to our webpage, put in a little online request, and we can help you work through these systems related issues or various clinical issues. If it's not something we can solve, we'll connect you with the right subject matter experts. So again, I'm sorry to be the bearer of bad news. We wanted to let everyone know at the start of the session rather than sort of springing in on everyone at the end, and didn't want to just share it in email if we could help it. But again, won't be the end. I know we're a tight learning community, and so we'll be seeing each other in some of those other programs. And we'll send out more detail in an email as well that will kind of spell out how you can get registered for those ECHO programs. But I'll also put my personal email address in the chat if anyone has questions or concerns. And our topic today does pertain to financial sustainability. And I know this is something we're all kind of grappling with right now, how to sort of operate in a new environment. And our fabulous Dr. Manson, I know, has many great ideas for us. So it will sort of all tie together for better or worse. But we just appreciate you all being a part of this program. I know we've had some great discussions here. And again, those will just continue in some of our other programs as we integrate these topics there. So I'll turn it over to Dr. Manson to jump into our didactic. And again, I'll put my email address in the chat if anyone wants to discuss offline. Thank you.
Thank you so much, Adrienne. I really appreciate you coming on and letting us know. And I really want to reinforce everyone here in the community to review all of the different echoes and start joining so we can continue all of this community efforts together. My topic today is related to developing financial sustainability, and specifically with utilization on using pro formas and ROI calculations. Now, normally when I do these presentations, I actually do workshops, which are like about a day long for organizations, sometimes 2 days, or sometimes I will do, an hour or 2 hours in a presentation. We've got about 20 minutes together. So I'm going to kind of do a brief overview of this, but I'm going to leave you with the slides, and I'm happy to send out even more worksheets and other types of kind of helpful tools to walk through with how to develop these as well. So just so you know, I'll make sure that Andrea and the team here has some of the worksheets and some sample pro formas for you all to consider utilizing. So let's just go ahead and jump on in and talk about it. I do want to say, if you have any questions, feel free to let us know, and you are welcome to turn on your microphone or put them into the chat box. And if someone can just kind of let me know if there's something there lingering, and I'll definitely address it. So I do need to say my disclosure is that I do not have any financial relationships with any commercial interest to disclose. Okay. And then we're going to be really talking about some strategies for fiscal sustainability, and we're going to be looking at very specific tools today related to that. I'd love for you all to be interactive and talk a little bit about your program, the difficulties or anything else, and you can open up your microphone and let us know, or just put it into the chat box. It's fine. Okay. So as I kind of move forward, I just want to say, up front, all of us here are so responsive to our communities. That's what we do. We end up building the plane while flying it. We end up recognizing that there's a community need, and we jump in and we put it into play. You need a food closet? Let's do it. Here's my food for the day, right? Then you go around, and others in your agency might be giving that food for the food closet. And so then you're like, great, now we have a food closet. But then ultimately, sometimes we forget to ask those questions. How much food does each person get? Does it depend on how many people are in the family? What types of food? Can someone get 2 things of protein versus, the other elements of food? What if they need socks now, right? How often can they keep coming in for that food? Who's going to sustain this long term? How do we sustain a food closet? These are things that we often don't think about when we're being so responsive to our community. So that's where these tools come into play. You can put these tools into play at any time. You can do it now to evaluate where you stand and identify areas of challenge and hopefully look at different resources and be innovative related to that. Or you can use these tools before you implement any changes and look at developing new programs or personnel. So we're going to look at that a little bit. I always recommend, as I walk through here, think about your community. What do you need? What do you serve? What is happening? How is your program, demonstrating success? How is it aligned? We want to make sure that you have a vision of your program. And as we walk through here, I want you to just kind of hold that to consider how you can apply these steps into what you're doing. Okay. I always want to say that there sometimes are very specific models, financial modeling, as well as even programmatic models to follow. And when we're able to align it, we are better able to have sustainability. Sometimes we have to misalign that based off of our community and who we're serving because it doesn't always meet it. But it is really important to really consider that too. Is there a model I'm following? And what does that model show as far as success, especially when it comes to finances, right? There's some core elements related to sustainability. I'm going to point out that NIATEX is in here, as well as lean and other types of pieces too, because last week Matt had talked about some of those pieces, or maybe it was the week before, or the month before. I really want to note these are those core elements that we always need to be looking at. And when we're starting to look at some of these tools, I want to emphasize you want to use these tools as often as possible. Okay, so you want to put them into play and then monitor them, say monthly or quarterly, okay, at the very least. I always encourage folks to really look at kind of our national quality strategy and our quintuple aims, because that really helps us to think more innovative and more creative when it comes to what are we going to do with financing? How can we keep these doors open? How can we sustain? If we look at in these different subsection areas, sometimes we can really do better brainstorms and get creative ideas of what to do. If you're working with a lot of populations that say are qualified for SNAP or food stamps, right? The state will also give you money for how many applications are completed. And so maybe you go, you know what, I'm already doing that and I'm not getting that money from the state. Maybe you need to go and look at being one of those contracted providers, right? Thinking about it a little bit more broadly and innovatively, because there might be things that you're doing that fall into other buckets that could be getting paid, okay? Ultimately, what we want to do is we want to stay away from a fatal event. And in healthcare, fatal events are obviously something where the individual dies. For organizations, we have fatal events all the time in organizations because we can't continue to keep the doors open. And so we really need to be building these tools in as much as possible. The first thing I'm just going to mention, and this can be an hour training just on this, element alone, but the 5 steps is a kind of a comprehensive review of how organizations can walk through thinking about how they're setting up a service line or their billing and coding related to it, and kind of make sure that it's aligned with sustainability. So one thing that people can do is kind of look through this. They can think about, what's my license? Do I have a hospice license? Is it a, substance use facility license? And then what are my legalities related to that? What am I eligible to do related to billing and coding, right? What's my site type? Do I have another type that I am listed under? Am I an RHC as well, right? What else am I, falling under related to my billing and related to my outcomes? Then who are my stakeholders and payers? What are they doing and contributing to my organization? And how are they giving me information related to outcomes? And what am I reporting to them? What do they need for documentation and alignment? Have I had conversations with my stakeholders, my payers? And have I talked to them about all of my services to see if there's other additional billing codes or ways that I can facilitate earning related to my program? Have I thought about negotiating with them even more? What am I doing related to that? Then the next line, all of this flows down to my workforce and providers. Who's my workforce? What does my team look like? Are they aware of all of these things above? Are they aware of the outcomes, the coding, all of these different types of responsibilities that are there? And do I need to look for specific license types? And how do I encourage that workforce to see us as a place that they'd want to be, right? To sustain and retain workers. Are they aware and are they getting training to do what we're asking folks to do? And then lastly, what do they need in order to be able to provide those services? And I need to also do a business case for this. So whatever I do, I need to be creating it using these tools I'm going to introduce. So this is kind of like a walkthrough. The 5 steps to sustainability have actually been republished about 38 times now in journal articles and books. And it's something that I created about 20 years ago to sustain some of my own healthcare practices. Okay. There are many ways that we can look at challenges, and sometimes those are things like just reading billing manuals and making friends with the billing coordinators at different insurance companies, with the state Medicaid office, right? And having direct times you set up to just have these conversations. Other things might be really looking at legislative efforts and advocacy. Sometimes it's about grants and endowments and donations, but ultimately most entities really need to look at community partnerships, partnering up with other entities that are either similar, even if you're competing, okay, or are not similar to you, but maybe you're adding something to it. So sites that might have a specialty focus. So considering whatever specialty population you might be working with, primary cares across the board need that assistance. They service those individuals. So how can you link up? Maybe there's contracting that you can do. Maybe they could be an outside entity where you place your providers there, or they bring their providers to you. Maybe competitors are feeling the same challenges and are unable to really sustain their workforce. And so you team up with them and say, you know what, we're both facing this. Could we kind of collaborate and offer to the employees that they can work part-time here and part-time there, right? Who can do the benefits, right? What does that look like? And really teaming up with community entities in very different ways than you ever thought before. So just kind of thinking broadly related to those. I know I'm speaking fast, but I'm just making sure I'm within the time zone here. The next tool I really want to introduce is one of the most powerful tools that you can have, which is a pro forma. And I would love to see how many folks in the chat box actually use pro formas now. Okay, so if you're willing, please put it into the chat box. I'd love to see it. But I want to introduce what this is right now for those who don't know. It is basically an Excel document, which is a visual of kind of money in, money out. How much is your program making and how much does it cost? It can also be broken down into each person. How much does this person make at our organization, right? How much are they bringing in as far as money? And then how much do they cost to the organization as well? And as far as value and money, even if it is individuals who are not patient-facing really regarding patient billing wise, okay, they still have a role within all of these things. And so really being able to sit down and go, how do I create this? I will say right now, if folks want to do this and you've never done it before, I'm more than happy to volunteer to provide some pro bono time to organizations and walk you through how to develop it, okay? Just one-on-one. But let's look at what this looks like, okay? So this pro forma is going to illustrate what your program or what your personnel are providing and whether or not you have fiscal sustainability. And what's great is that pro forma does all the math for you, okay? You do have to get some information, so you'll have to get some of these specific things. You need to know what your costs are, how much you're paying them, right? What does that look like? How much rent is, all of those things. You also need to look at specific types of reimbursement. Where am I getting reimbursed for whatever they are doing? What is that looking like on this? So if you have grants and you're predominantly grant funded, you'd be taking 10% for each employee if you have 10 employees, right? But there might be overhead to the grant. So maybe you're only taking 5% of the grant amount to each employees because that additional amount needs to really work on the overhead for that. So you have to really think through, how am I getting paid and how am I really paying for all of these team members? And then in this, it'll actually be able to display it all for you. Okay, so the pro forma, you'd end up using it to really show your fiscal sustainability. You use it for growth and program changes. Also, human resources uses it because they're able to take your job description and they link every single aspect of that job description up to an element in the pro forma. Because we can typically take any action on a job description and put it into the pro forma and tell you how much that costs or what that is related to money making in your organization, okay? So really you use it for a lot of decision making, okay? This is just kind of showing you a brief example, and I have many examples, and I'll send an example to Andrea so she can send out an Excel document that folks can use. I'll send a real basic one so that you can use it and kind of know how to do it, okay? I also have pro forma worksheets that kind of walk you through thinking about some of the things so that you can do it on paper if you're interested in that. Okay. And I also have return on investment analysis worksheets as well. We'll send out. Okay. But ultimately, these are kind of like the basic areas you need to know, right? Basic money, costs, and revenue generation. And so I'm just going to walk through it, just kind of showing you a real basic example of putting it together. Okay. So when you think about it, you're going to be thinking about all those pieces. You want to think about salary and bonus and incentives. You also need to think about everything when it comes to how much you're paying for an employee. That includes a lot more, like things like this: benefits and payroll taxes, overhead and indirect costs, productivity related concerns. All of these things can have costs that are identified on your pro forma. Okay? So it's really important to really consider what those look like. I also have a slide with a lot of costs on them, so you can get a little bit more of an idea of what that looks like. Okay. You want to also calculate kind of that income generation from that person and the services they're providing. It can be in any of these areas that you're really going to look at and consider. Okay. So walking through a brief example, okay, would be, hey, this person sees about 6 people. They work about 250 days. I average get paid about $85 per each of these visits with this person. Okay. So simple math that's built into the pro forma would show that you're going to make about 127,000 at the end of the year doing this, if this is correct. Okay. And then you go, oh, you also get about $10,000 to cover their salary. Wonderful. Well, now we've got a total income of 137, right? But then I have to say, always remember when you're building one of these, count for the fact that you're not going to get paid. We know that so often in healthcare, we have companies that will not pay us for things we're supposed to be paid for. And sometimes they pay us for things that we're not supposed to be paid for. But just kind of recognizing that we might not be able to collect the billing from everybody. So maybe consider, is it a 10% loss? What does that look like, right? So now I'm reducing their reimbursement down a bit because I'm not going to collect all the money, right? So then I go, well, how much does this person cost? So I say, let's say they have a base salary of 85. Okay. So that's just the base salary. There's a lot that goes into it. So here's that screen that shows you all the other information there. This shows you some information about payroll taxes, Social Security, Medicare, all these different areas that you might want to consider when you're thinking about the cost of an employee, because it's not just their salary typically, it's a lot of other pieces that you're paying for. So in the end, this employee that was 85 actually costs $121,700. Okay. And that could be even being conservative, depending on some of your other types of costs or kind of packages that you have for the person. Okay. So then we put it into the pro forma and we say, okay, we've got their costs. Okay. And we've got how much they make. So I'm going to take how much they bring in for the organization. I'm going to minus out their costs and see what's left. In the end, there's about $3,000 they're making for us for the year. So that means they are sustaining themselves if they're able to see that many people per day, right? Those 6 people. So in the end, that's about a 2.5% return on investment, which means that for every dollar earned, we are bringing back in 3 cents, which is awesome. Okay. So these are things that we need to be thinking about and doing. In order to be successful, we do need to keep track of our finances. We need to stop and make time. Literally, we have to close the door and say to our offices and say, okay, for the next 24, 48 hours, I'm just working on making sure I've got these things done. I'm looking at the pro forma development. I'm looking at where our costing is. I'm really looking at all of our financial monitoring for a period of time. Okay. It's really important so that we can build those sustainability pieces. I did add into these slides a few other things for your review. Some of them are things like questions to ask yourself. As an entity, before we're so responsive, and I'm saying it's still okay to be responsive and turn over and be like, oh, we need food. Here's food for today, right? It's okay to do that. But for long term, we need to stop and say, how am I going to sustain that? And walk yourself some very specific questions to make sure that whatever you're doing, whatever open door you're providing, whatever additional service you're adding, you're walking through very specific questions to ensure that you're able to build this and bring it on sustainably. Okay. So here's a list of questions that you can kind of consider. Okay. I also have lists of costs you consider. And these will all be given in the slide deck as well. So you'll have that. So these are things that you can kind of consider. I need to be thinking about all of these things when I think about programs and bringing on personnel. Again, it's not just salary. Now, the next thing that people always say was, I want my ROI. I showed you in that pro forma, you're able to kind of break it down, and then mathematically, you actually get an ROI. Because what's nice about Excel documents is that the ROI calculation is built right in. And so in the pro forma, I'll give as an example for all of you, it's built right in. So as long as you follow all of those things, you will be great, okay? And so this is really important to do these ROI because you're going to use it for negotiations in the future. You're going to be really able to use them into talking with other entities and to build and sustain your organization. There is a very specific calculation, and this is the calculation right in front of you. It is the same calculation that is used in all healthcare entities and general business entities. It is the gain that we get, so the amount of money we're earning, minus the cost, so that could be the cost from that person or the cost for the entire program, divided by the same number, so that same cost again. And then whatever that equals, we times it by 100, and then that gets us the percent for the ROI, okay? So that's how you do it. And built in the Excel pro forma is that as well. So it's all done right there for you, okay? Very clear and very easy to understand. There's also a cost savings ROI. That one's a little bit different. It is a little bit trickier. Most people use the direct ROI. If you're thinking about making decisions in healthcare, you might want to think about the cost savings. This is something where you already have something in place, and what you want to do is do something cheaper. So say I currently buy a very specific nice type of toilet paper, right? And that toilet paper costs me $5. Right? But I really want to maybe consider changing my cost. So I'm going to look at the $1 toilet paper. That's then how I would use this is I already am doing something and I want to look at what's the difference if I use something different or if I purchase something different or if I pay someone else to do it and they have a different cost. What does that look like? Okay, that's what this is about. Okay. And that's when you're going to use this specific equation. Okay. So that's the big pieces of here. I think I'm just at 20 minutes as of right now. So I'm going to stop it here and see, do folks have questions? And I'm happy to show you any of my handouts further or another example pro forma if you're interested.
Thank you, Lesley, for that great presentation. I think at this time we'd want to open up the floor to the Learning Network. Does any of you folks have any questions for Lesley about her presentation, about performance? Any questions whatsoever, feel free to unmute and ask away.
I have a question, Lesley, that I think others might be thinking of, which is I don't know how to find all these separate costs. I mean, that sounds like a lot of detail, and I don't know how to get all those animated, all those itemized, separate, distinct costs. I mean, how does an organization go about finding that stuff?
Yeah, that's a really good question, Matt. So what I do recommend for folks is if you do have someone that's in charge of your finances, is kind of inquire with them and try to obtain that information. If you don't, and say, or you do, and you can't get a hold of them, one great use is to use AI technology. You can actually throw in the salaries into AI technology and say, can you give me a breakdown of all the additional costs related to taxes and payroll and other items that I need to be adding into the salary to really get a view of what the costs are for a person. And it will tell you. The other thing is if you're the entity and you're like, the costs are everywhere. I don't have it all very well organized for myself in a clear spreadsheet. Okay. Then I would be looking at, go back to your last taxes, especially if you're a small entity, go back to that and kind of pull it out. Usually the tax areas will subdivide it for you, which is nice and give you some of that information. And so then you can use that information to be able to look toward the future. And even if you aren't able to subdivide it all out, if you have the larger amount that you are paying for them, you can just use that. You can also use the percentages as I showed you in the screen earlier, or just do something that says, traditionally, we're about 20% more than the salary, and that's inclusive of all of our taxes and benefits that we provide. Some entities just go with a standard percentage, and that depends on the entity. The average is anywhere between 16 and 30%. On top of salary is the additional costs for a person at every workplace entity. So hopefully that's helpful for folks.
Great. Do we have any other questions for Lesley? looks like Jared and Nick had some great praise for you in the chat there. Are y'all familiar with using Pro Formas by any chance, Jared and Nick?
Excuse me. Yes, I use them all the time. I'm in
Great.
finance, by the way. So yes.
Gotcha. Great. Okay. No worries. Any other questions for Lesley from the Learning Network? All right, no worries. I did have one more question. Lesley, how often do you typically see the use of performas, or is there also other alternatives that can be used in the place of that, in these, like in setting up these business?
Usually most people will use a pro forma. Sometimes they'll just use their traditional Excel documentation that they might be running. So maybe a prepackaged a computer program that maybe they purchased. Typically, those will actually have a pro forma built in. So that's always nice. It's already pre-done for you. So maybe they didn't call it one, but that's what they're doing. I do encourage everybody to consider doing it now. I encourage everybody to look at them on a regular basis. For most entities, it's going to be monthly. For others, it would be quarterly. But that would be the least amount of time to look at them would be quarterly. But truly, especially in these times, all of our entities, we need to be really looking at these things and identifying where are our challenge areas and then thinking critically about, as I said before, aligning all of our job descriptions up with it. What am I missing in this job description that they're doing that we're not getting paid for? How can I think about doing that? Are other people getting paid for that? Let me start searching that. Let me reach out to other entities and having conversations. Maybe consider teaming up or being a little bit more innovative related to that. And I do want to put a plug in, perhaps even as folks are looking at more echoes to join within these communities here, right? Perhaps they might even get access to even more ideas from other entities about how to do that, how to be innovative in a different way, or how to broaden or how to partner up with other practices to have more sustainability.
That is definitely a great plug. I know all of our echoes are very, very varied in content and information, so there's always a lot to learn from them. So with that, I think now is a good time to go ahead and move on to some announcements. Again, thank you so much, Lesley, for your great presentation. Riddell, if you could share the announcement slides, please. All right. All right, so please stay connected and register for one of our ongoing CSAT EGO programs. You can scan the QR code above there on the screen or visit the link in the chat to learn more about our programs. Next slide, please. To claim your CME credit, please text the code ATTEND 100-98634 to the phone number that you see there on the screen. You should receive a reply saying success. If you have any questions, please email cstat@utesca.edu. Next slide, please. The Center for Substance Use Training and Telementoring offers technical assistance for various substance use disorders, needs, and topics through our network of subject matter experts. To request technical assistance, please complete an online request form, and we'll be pleased to help you, and that link is also going to be in the chat. Next slide, please. We're excited to announce that the next TXSUS session is on Friday, May the 9th. Join us as we highlight innovative approaches to integrating addiction services in hospital systems and the frameworks that support their success. To register, please visit the link in the chat. Thank you so much. You can close. All right, and let's go ahead and move on to our case presentation for today. Riddell, if you can bring up the slides. Jenna, please tell us a bit more about your organization. What are some of the challenges that your organization is currently facing, and how can this community of learning help you today?
All right. Thank you very much for asking me to do this. That was an awesome presentation, and now my brain's going 90 miles an hour about all the things that I need to do here. So I'll definitely look forward to those slides. So a little bit about my organization. LifePath Systems is a behavioral health authority for Collin County. My role here is, as I mentioned before, program administrator for substance use services. Quick summary, just as the local behavioral health authority, we provide mental health and substance use services for individuals in Collin County, primarily focusing on the indigent population, individuals who don't have insurance or income to pay for their services. We are a governmental entity, receive state and federal funding for most of the services that we provide. We are also, as it says there, the local intellectual developmental disability authority. So we manage the wait list for state for IDD services and those types of things. We do just a little bit of everything. We have early childhood intervention, so we also provide therapies and supports to babies who have some developmental delays and things like that. So I got sidetracked. I was thinking. So some of the barriers when I was asked to kind of review this, of course, the first two things that pop in my mind and are specific to my area. So substance use services, staffing, which ironically that presentation before just, kind of looped into that as well. So staffing, shortage of LCDCs, with most of my programs, the requirements and stuff are requirements for staff are licensed chemical dependency counselors because we specify in the substance use treatment. Have a hard time with finding LCDCs. And so, and then when I do, keeping them here because they're a lot of times pursuing higher education and more licensure, and then they move on to doing different things. So that's definitely a barrier, staff retention. And then also transportation for our individuals to attend services. COVID provoked the telehealth, which a lot of people got very used to. In the substance use treatment world, I don't know how many people on the call are work with the substance use treatments, but face-to-face services are generally better for this population of individuals. And so they got accustomed to telehealth. When we came back into in person for things, transportation is a barrier. It was a barrier before, but it's definitely a barrier now. And so just finding the means to get people here, to attend services. In our area, not a lot of public transportation. And so we rely upon, Uber and Lyft and things like that, which are very expensive. We have been able to put funds in some of our programs to assist with transportation and things like that. But as someone else mentioned before, with some of the recent changes in funding and stuff like that, that's not available anymore. So what else am I supposed to go into? I could probably talk for way too long.
No, no worries at all. I think that was a really great sum of what you're here asking for today. So with that, I would like to turn this over to our learning community. Any questions you all have or any suggestions, feel free to unmute and pose them for Jenna.
We were chatting earlier, Jenna, about your workforce and how, because it is working with folks with IDD, that might not be as broad of a kind of net of potential employees, and it's a little more specialized and specific. And we were just curious about your strategies now and how you go about recruiting. And it sounds like that is a challenge. What do you do? And I'm curious if people have thoughts about things that you might be able to do to more effectively recruit people who, particularly as it relates to retention of staff, because it sounds like you have that turnover challenge that many organizations do have.
Absolutely. And center wide. So with all of we have the 3 different divisions. LifePath currently has, I think, somewhere around 600 employees, which I've been here almost 9 years. And when I started 9 years ago in our behavioral health division, there were 50 employees, and now we're pushing over 300, closer to 400. So definitely a lot of growth in the area. As far as staff retention, we have an amazing human resources department that does a lot of recruiting. They're at job fairs, they're holding job fairs. We have specific, what's the term they use? I think they call them reverse job fairs. If y'all have heard of those, where the people come in telling our teams what they can do or whatever, and vice versa of a regular job fair, right? So we work with our community colleges who have programs for clinicians or roles that we may need here. We definitely do a lot of networking and stuff like that. So we do as much as we can. I just think this is probably, like you said, in this world, we do have a lot of turnover. My department specifically, like I said, I'm just seeing a decrease in people pursuing an LCDC. The requirements for that licensure have changed pretty a lot over the years, where it used to just be a certificate class where you took 9 classes and then you went and got your license, and then then it was you had to have an associate's degree, and now it's a bachelor's. And a lot of people are just pursuing that master's level licensure, and of course salary becomes more and things like that. So that's where I have a lot of barriers, just specifically in my world.
It looks like that Bianca had a question about your intern situation. Are you able to hire those or use interns? And that would also be for your behavioral health, I would think.
Absolutely. So we, several years ago, I applied with the state to be a clinical training institute, a CTI for LCDC interns. So absolutely 100% we'll hire interns. I mean, I like to be able to give opportunities for people going into the field to get the experience, to provide the training, and, to show them what we do here. So we've had several interns go through, and some of them are still currently employed and now fully licensed.
And this is a follow-up question for me though. Do you have any payment for their training? Do you do any type of contribution to what they would do? So if you find a really excited behavioral health provider who wants to get that licensure as well, do you all provide any subsidy for their training?
So we do have like educational reimbursement, things like that they can go through with HR. We just recently, and I'm part of that because I am a licensed person. I have my LPC and my LCDC. So we actually have just we've had it in the past, but now we've just ramped it back up again, taking in interns, so practicum students that need hours so they can get experience and see if this is the world that they want to really, pursue a career in. And then interns, once they finish their graduate programs or whatever bachelor's level programs, and need internships for. That's LPC, LCDC, social work, LMFTs. I'm actually doing practicum with 2 different licensed marriage and family counselors right now, which is a little different than what I'm used to. But we're all for giving people the experience and figuring out how to get people in. Yeah.
So I put a number of questions in that are follow up to those as well. So just thinking about how you're really looking at this workforce. Are you going to those programs, those schools, the education training for LCDCs and presenting and saying, hey, I have jobs for you? Are you talking with them directly to give you referrals for that?
I don't. A lot of our HR handles a lot of that stuff. So yes, they're out in the schools. We have an outreach team that does trainings and different things at the schools. So definitely making individuals aware that, hey, this is Life Path. This is the things these are the positions we have open. And, if you think that's something that you're able to do or interested in doing, then definitely come in and this is how you would apply for a position.
I think that's awesome. I think that's going to be a really big thing to do more of that and really get direct, references from the other instructors in those programs, but also maybe even considering here, what we do is we go to high schools, and a lot of high schools welcome us, and we really get the workforce right there and say, hey, if you're interested, we'll help you with how to walk through this entire process. So just thinking about the earlier on, we can do those things, and it can really lead to more benefits. And oftentimes that also leads to referrals for some of our other programs. Honestly, that's not the reason for it, but sometimes that's what occurs with that. And then the other thing I was thinking is, have you considered, do you charge for your supervision and the process that you're doing that? That's different. Some states have rules that you can't charge for supervision, but I'm wondering, do you have that? And are you charging for supervision as another entity?
I don't personally charge for supervision, because most of the people that I have supervised, actually are employees. I mean, I guess, yeah. So I've never, do other clinicians that supervise different roles? I don't think so. I'm not sure if there's like reasons why we can't charge, but again, kind of just trying to get people in the whole idea of, hey, if you're an intern and you need your hours, come work for us, get your feet wet by doing the actual work, all while we're supervising your intern hours, right? So kind of we're not going to charge you if you'll come and work for us kind of thing. So
100%. I think that's a great pathway, and a lot of entities offer things like that, and it's very helpful. It's like a benefit, right? But just thinking about another innovation side is there are a lot of students out there that do need supervision, and it's actually very hard for students to get supervision. And so thinking about for entities outside of that, if you're struggling with sustainability, and if you can have another line of work, perhaps offering that through even telehealth to entities outside of your organization, and have a revenue stream related to that for the organization. And then the only other thought I had is there are a lot of other entities that are using your workforce, right, that use LCDCs, and wondering about, have you thought about joining forces with them a little bit and seeing if those providers want to work for you part-time, or offering something like that, so you're not stealing them, but you're joining up with them very clearly.
Yeah, I mean, I think the LCDC world is kind of a small world. I mean, I recognize names on here, of people that I know are LCDCs, and work at other providers. So, I mean, it's just a small world, right? We kind of all know each other maybe to some extent. I'm not stealing people, but I definitely know to, I mean, I've had staff come from other places, other facilities, because they want a different atmosphere of what we do, right? So yeah, I think on our state calls that we have a lot, this is definitely a very common theme amongst, I'm not alone, right? I'm not the only one in the world that has this barrier. So we talk about it a lot as far as being able to get LCDCs and those types of things. It's one of those things where you have to meet the requirements of contracts, but then you want to get staff in, and it's just a catch-22 sometimes to try to finagle, which is my favorite word, to get the right person in the position.
I was just thinking, Jenna, about the broader systems, macro systems decision making, the unintended consequences related to increasing the training requirements and upping the skill level. Of course, this is a good thing. Why? Of course, we want people to be well trained from associates to bachelor's degree. Of course, then that gets them much closer to leveling up to the master's degree. And so now the threshold to entry is higher. And so it's a barrier on the kind of front end. And so it's fewer, it creates a challenge for those. It's an interesting question to propose. Is there another way to have that entry level position and to keep that step in the process for people, because it's kind of been eliminated, and so this is contributing to the workforce challenge that you're experiencing.
Absolutely. And then you throw in the income piece to some of that, and that's also kind of a barrier, right? That a fully licensed LCDC who can diagnose and do some things makes less than someone who doesn't have a license, because of the education level or things like that. So yeah.
Yeah. Yeah.
It's a little tricky.
Yeah. Yeah, for sure.
Great points, everyone. Is there any other questions or comments, suggestions for Jenna from our Learning Network?
I'll just share that I'm confident in listening to you, Jenna. You have a quick analysis on these variables. So when you said finagle is your favorite word, I have no doubt that you're a good finagler.
After all these years, I've learned to finagle very well.
Yeah,
Absolutely.
I hear that.
All right, no worries. Sounds great. One more time. If we have any other questions or comments or suggestions for Jenna, please feel free. Yeah. All right, so if we're good, I think we can move on to the case summary. Kathy, could you please give us a summary of recommendations for today?
Well, it's really hard to summarize a lot of these recommendations because Jenna has really kind of covered all her bases. But if we start, I mean, I can't think of many things that they haven't tried or she hasn't finagled. But going back to Lesley Manson's presentation, just really focusing on that pro forma and how to maximize your ROI. I think that you have some really good suggestions and tools that you can get started with if you're not already using those. I think really looking at more creative ways to use the community to access other providers and other types to enhance your own services as partnerships. I think everybody is starting to look around saying, okay, well, you have this and I have that. And that's what integration is all about. So it sounds like you all are starting to merge with not just your internal, but your external partners. And that's a good place to look. And then possibly thinking about ways to get, more incentives for your own staff or for others to come in and to train while they're on the job and grow your own, as we always say.
Sorry. Then you had to, so I was talking and I was muted. Thank you, Kathy, for that great summary of recommendations. And thank you to everyone that has attended today's session. As a reminder, to earn C credits, please text attend 100 98634 to 844-502-1338 by midnight today. We also request that you complete the post-session feedback survey using the link in the chat. Thank you for all of your participation and feedback throughout these sessions. You truly make each of these echoes a joy to attend and facilitate and host. We encourage you all to join us at our other Be Well Echo sessions to stay connected with your peers and our experts. Have a great rest of your day. Thank you so much.